Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Nicholas Daniels. He's an internal medicine physician. We're going to talk about his book, Outbreaks and Pandemics, The Life of a Disease Detective. Nicholas, welcome to the show.
Thank you very much.
So we'll get into your book in a little bit. First off, briefly share your story and journey.
So I grew up in Buffalo, New York, in a pretty resource-limited, racially segregated neighborhood in Buffalo. I received a scholarship to go to Cornell University, where I studied pre-med studies in biochemistry. Afterwards, I went to Yale University and did a master's in public health and infectious disease epidemiology. Decided I wanted to live on the West Coast, and I moved to Seattle to the University of Washington to attend medical school. And then afterwards, I went to UC San Francisco to do my internship and residency in internal medicine, followed by a fellowship at the CDC in Atlanta, where I did the Epidemic Intelligence Service, the EIS, for a 2-year fellowship at the National Center for Infectious Diseases. Following that, I worked as a consultant for the World Health Organization based in Southeast Asia, in the Philippines, Cambodia, Laos, and Vietnam. And then I came back and joined the medical school faculty at UC San Francisco and then UC San Diego. Currently, I'm at Mayo Clinic in Scottsdale, Arizona.
All right. So you wrote the book, Outbreaks and Pandemics, The Life of a Disease Detective. So tell us, what led you to write this book?
Well, the book and the article was based on my memoirs. So it was about my life story, growing up in Buffalo, all the way up to the present, sort of following my career, outbreaks and pandemics that I've lived through and worked through as a doctor, as an infectious disease epidemiologist. So it was really telling my life story. I think one of the key things that I wanted to highlight was the lives of disease detectives. They do incredible things. They help characterize diseases, come up with control mechanisms, strategies to reduce and to save lives. So I think there's not a lot known about them. They're working sort of in the background, but they really are the backbone of our public health system and are critical for us to deal with outbreaks and pandemics. That's really where it came from. I'll tell you a little bit about what a disease detective does. They're good at figuring out transmission routes, dose response, risk factors, environmental surveys. They do surveillance of diseases, how much, where, when, and where, who. And then they'll conduct epidemiologic surveys, case control studies, cohort studies. They'll analyze the data. They'll look at evaluating the efficacy of vaccines, are prevention efforts working. Then they're communicating the results and their findings on and on. Many disease detectives work 24/7. You never know when there's going to be an outbreak or a pandemic. I know during my 2 years at CDC, I basically lived out of my suitcase. I was on call. And at any moment I could be told, you're going to Africa or Asia, we have an outbreak, we need to respond. So sometimes these disease detectives may actually put their own lives at risk, not knowing, going into an unknown situation.
Tell us a story of one of those calls where they had to call you either to somewhere in the United States or overseas to track down a disease, and run us through that story.
Yeah, so I'll give a few examples. So one outbreak was a cholera epidemic in West Africa, Guinea-Bissau. They were having a cholera outbreak, thousands of people sick, thousands of people coming to the hospital. So we went and we set up a clinic, and we went to the emergency ward where we saw people being carried in by their loved ones to the emergency room department, near death. And what we found was that people, the mortality rate in this clinic was 10, 15, 20%. Cholera case fatality rate should be more around 1%. So why were all these people dying? What could we do to reduce that mortality rate? So we developed an intervention to figure out why people were not getting better on the cholera ward. We tested the ORS, the oral rehydration solution that was being given, and we found what they were using were open buckets, and people were allowed to dip their cups into the buckets to retrieve water. We analyzed that and found cholera, we found typhoid, we found other coliform bacteria. That was the reason why folks were not getting better. They were becoming reinfected. So what we did is we had a vessel that was a closed mouth with a spigot so that people could not dip their hands in cups inside. They could use the spigot to dispense ORS. And we were able to also use some bleach or some chlorine to purify the water that was going into making the ORS. And we were able to figure out and provide ORS that was not contaminated. We tested it, it was completely clear of other microbes. And as a result, people got better. They were able to be discharged. And I think that simple intervention, and when we left, we basically, in conjunction with Procter and Gamble, gave out all of these vessels to cholera clinics throughout Guinea-Bissau, and the mortality rate went down. So I thought that was a sort of real life intervention in the midst of a pandemic, not knowing what we would see until we got there. And I think we came out and really made a difference.
Tell us the role of disease detectives in our most recent pandemic, which of course is the COVID pandemic.
Yes. So there were disease detectives working in the background. I would say, unfortunately, during the COVID pandemic, many of them were sidelines, at least CDC and specifically. I had lots of colleagues that, they couldn't speak to the public. They were told what to say. So I think we really didn't have tremendous use of them during it because of political situations that they were in. Their hands were tied. So we didn't really have the leadership that we needed during COVID. And I think that's one of the reasons why we had so many deaths and so much misinformation. And so that's a problem. I mean, there were some disease detectives that spoke out early. They talked about masking and social distancing, but quickly they were sidelined. That was not the message that the government wanted to get out to the public. So it was not a very good situation, unfortunately, during COVID. And very similar during the HIV epidemic as well. There were political factors that caused messages not to get out because of political reasons. So I think one of the key lessons is that we need to try to get politics out of public health. Public health is so important. It affects everyone, regardless of political affiliation. And we need our disease detectives to be out front and not sideline during these pandemics.
Now, in your ideal world, let's say we did remove the politics from it, what would have been your ideal scenario for the role of disease detectives during COVID?
Yeah. So they would have been, in the ideal world, we had a CDC official who was embedded with the CDC in China before the pandemic, but she was recalled, someone I know, recalled back to the CDC 3 months before we heard about COVID. So if she had been there, we probably would have heard about it earlier. So I think by the time we heard about it 3 months later, it was too late. It had already spread around the globe by that point. So containing it would have been very difficult. So what we need is countries, when they notice that there's a pandemic of global proportion, they need to notify WHO and to let us know so that we can be prepared. But in general, for the next pandemic, we need to be prepared. We need to have masks, PPE for patients, gloves, protecting our healthcare workers. We need to have reagents. We can't run out of reagents for running tests. We need rapid tests available. We need to have a sufficient amount of ventilators so that we don't have to decide who lives and who dies from, rationing of care.
Now, the politicization of the COVID response, how has that affected the effectiveness of disease detectives going forward?
Well, I'm hoping, under new leadership, CDC will be able to take its position as a leader in public health. I mean, not only are they the leader for the United States, they're the leading health agency in the world. Everyone looks to CDC for guidance on public health issues. A lot of the officials in other countries have trained at the CDC. They come to the CDC. CDC goes to them. We have a very strong global network of public health people that all know each other and coordinate, but they really do look to CDC for leadership. So we need that leadership to tell us what we need to do, work with WHO, work with member countries, and to advise them, how do we get this global pandemic under control? We need that coordination, and CDC really needs to be the key person to coordinate that response.
Now, I think the political climate, as you mentioned, it really led to a lot of mistrust against our public health officials. How does the CDC, and more broadly speaking, our public health officials, how can they regain that trust in our polarized environment here in the United States?
Yeah. So I think it's possible. I think CDC can regain that trust. They have to speak honestly with people. They have to explain to people what's going on. I think in general, doctors and public health officials need to do a better job in explaining complex medical and public health issues to patients so that they understand them, that it's not all about you as an individual, it's more about the group. They need to learn more about risks and benefits. What are the benefits of a vaccine? What does it do? I mean, there's a lot of education that needs to be done. And you need to be honest with the public. I mean, I think there were some things where some officials were less honest, or they were giving some misinformation. And when that happens, you lose the public's confidence. So you have to be honest, you have to be straightforward. But I think it can be rebuilt. The trust can be regained and the public will respond. But your messaging has to be correct and honest and straightforward to people so that they can understand it.
What was one example where public health officials said something that you didn't think was quite as honest as you would have liked?
I guess I have two things that come to mind. One would be when they were telling people to go out and to make masks, cloth masks. I knew that cloth masks, they really hadn't been tested. They were going to provide protection. We needed N95 masks, we needed surgical masks that are much better in preventing respiratory droplets. So when I heard that, I thought, oh my God, they said that because there was a shortage, but it was misleading that somehow these things that people were making at home were going to protect them against COVID. And I knew that they were not tested and were not going to be effective. The other thing is, after vaccines had been made available, after Paxlovid had come out, they made statements that these things were going to be distributed equitably. I've been in medicine now 30 years, and I have very seldomly seen things in medicine that be distributed equitably. So it was clear that pharmacies did not have vaccines in certain neighborhoods. People would have to travel long distances to get their vaccines. You couldn't get Paxlovid in certain pharmacies. If you had access and had money, it was easy for you to get it. So that disparity persists in most things, and it persisted throughout COVID, even though the official line was that they were going to try to make things equitable. In reality, that I didn't see that at all.
What kind of training does one need in order to become a disease detective?
So, since the 1950s, CDC created a program, the EIS program, which trains sort of elite level disease detectives. They're usually medical doctors, they're veterinarians, they're PhD bioscientists, and they take in about 60 to 90 per year. So there's about 180 elite disease detectives at CDC every year that are working. And there's a ton ton of alumni that are still in connection as well. So that group is there. They're well trained, ready to respond to anything and everything. Incredibly talented group of people that are passionate about public health, that want to do this work and get out in the field and get their hands dirty and try to come up with something. So I think that's good. They also bring people from other countries. So there's a lot of international doctors that come and train to take that information back home to help globally. Is really, we need to be strong here, but the world is so interconnected now that we need everyone to work together on the planet, because within 24 hours, the virus here could be anywhere else in the world.
Now, tell us some of the other main messages that you want to share from your book.
Yeah. So, one of my areas of interest and expertise is foodborne diseases. And I would say I feel most passionate about Vibrio infection. So in Africa, I worked on Vibrio cholera. In the US, I've worked on Vibrio perihemolyticus and Vibrio vulnificus. And Vibrio vulnificus is a severe infection that's associated with eating raw or undercooked oysters. They can cause gastrointestinal infections, they can cause sepsis, they can cause horrible wound infections, sort of often described as flesh-eating bacteria, sort of similar to group A strep. So these are horrible infections, and you acquire it from eating raw or undercooked oysters or contact with an open wound with seawater. Sometimes this infection can lead to a limb amputation, a leg, arm, be horrible. This past summer, we saw an increase in those numbers of cases in New York, Connecticut, Florida, all over the country, in part because the water temperatures had increased. It was an El Nino year. I had written a paper in the late 90s, and I had an abundance of infections that year, and I attributed to the water temperature being high, where the bacteria can proliferate. They're naturally occurring bacteria. They're not related to sewage, but they proliferate and can get to a high dose where they can cause very serious infections. There are technologies to get rid of these microbes in oysters and shellfish, but they have not been readily utilized. There's been some resistance on the part of the oyster industry and their congressional leadership in Congress to stop additional regulations to make oysters safer, but they can be made safer.
Now, for those who enjoy an occasional raw oyster, what kind of advice do you have for them? Is it just simply a risk that they have to accept? What should they do?
So eating oysters is definitely a risk. They've done personality studies and found that oyster eaters, on the edge. They're risk takers, people who eat raw oysters. So the people that are at greatest risk for complications from Vibrio infections are those with compromised immune systems, with chronic liver disease. Otherwise, healthy people should probably avoid oysters between the months of May and October, because during those months is when that bacteria is at a high level. So I would say outside of May through October, where we see the most cases, in the fall, in the winter, the cooler months, the count of bacteria is relatively low, that it is unlikely to cause many infections.
And there's nothing a diner can do to smell, see, or taste the Vibrio infection. Is that correct?
Not at all. It tastes fine. People tell me all the time that oysters, they were great. But then, I'm hearing about their cases and that they got sick 24 or 48 hours after eating the oysters, and they can be quite severe. So, there are warnings on menus often telling people that this could be a risk, but I'm not sure how many people read them. Early on, there were only in English, but then they eventually added Spanish so that multiple people could read them. So
we're talking to Nicholas Daniels. He's an internal medicine physician. His book is Outbreaks and Pandemics, The Life of a Disease Detective. Nicholas, tell us some of your take-home messages that you want to leave with the KevinMD audience.
So I would say a few things. So I would want the audience to know that it's important for them to advocate for a sufficient PPE in their hospitals, their clinics. This day and age, we should not be running out of PPE or masks. Healthcare workers shouldn't have to don garbage bags to protect themselves. So let's make sure our hospitals have sufficient PPE now. The other thing is that I want them to advocate for safer foods. Some consumers think that food that they buy from the market has been tested and it's been found to be safe for consumption, which is far from the truth. The meat, fish, chicken, pork, fruits and vegetables are often covered with bacteria in our supermarkets. And during the wintertime, a lot of our fruits and vegetables come from other countries, Mexico, where they don't have similar food safety standards that we have here. And only 1% of those imports of foods are actually being tested at all. So there's a lot of things that are in our grocery store that can be potentially unsafe. And we need to tell the public to make sure that they wash their food thoroughly, they prevent cross-contamination of foods, and consider their food contaminated and to wash their hands. You have to be very careful with every food that you bring into your home to try to reduce that risk. Again, there's technologies that are available. There's pasteurization, there's irradiations, there's UV light, there's high pressure, things that can eradicate these microbes from our food. But again, a lot of that technology is not being used. So we have to be safe. The other thing I would say that the next pandemic is coming. It'll probably be another respiratory virus from a bat or some animal. The fact that we're in closer contact with animals now more so than ever, we're going to see this zoonosis, animals to human transmission of viruses. And we may find another virus that we have no immunity to that are at risk. So that's going to happen. And I think we need to be prepared for that.
Nicholas, thank you so much for sharing your time and insight. And thanks again for coming on the show.
Welcome. Thank you.